substance abuse isn't just a personal struggle. It weakens the very communities within which it exists. It fuels crime, domestic violence, and social problems. Experts say the battle against substance abuse demands communal support. In creating this social impact, government, businesses and members of the public have been urged to join hands in the fight against the scourge. It comes as the country marks the 2024 Drug Awareness Week. Experts are calling on communities and church leaders to organize a voluntary rehabilitation program to provide support to victims of substance abuse. Over and above rehabilitation programs, experts are calling for workshops that focus on essential life skills such as problem solving and setting boundaries. Spokesperson for the Central Drug Authority, Dereleen James, joins us now for a discussion. Dereleen, a very good evening to you. Thank you so much for joining us. Let's talk a little bit about the importance of this week as we look at the impact of drug usage directly and indirectly, of course, affecting communities and families.
Thank you so much for having me. I think I've said it over the years that our country is faced with a multifaceted challenge, a challenge that we cannot just have a blanket approach in addressing it. We need to empower our youth, we need to empower our communities, and we also need to look at the various pieces of legislation to see, is it actually relevant and does it actually find expression within our communities? When it comes to substance abuse, substance use disorder and illicit drug trafficking, just speaking about my community where I live, El Dorado Park, it is actually sad to see what many families, what many communities have to endure, gang-related violence, drug turf violence. It cannot just be addressed, at national level. It cannot just be addressed at local level. We need all spheres of government and we need all facets of society involved.
When you speak about all spheres of government, are you talking also just referring to how police need help to deal with this? Because we see a lot of it relating around how communities could gather up and identify the culprits, but then failure comes when the law needs to take its course, therefore now exacerbating the problem and having more and more young people just really destroying their lives.
The Substance Abuse Act 70 of 2008 is actually clear when it comes to the response, when it comes to responding to substance use disorder. There are actually 21 departments that's responsible, 21 departments in our country that needs to have a mini drug master plan. And for many years, I have been serving. I'm no longer a member of the Central Drug Authority, by the way. I am now a member of the National Assembly. And those 21 departments failed to produce that mini drug master plan. We also know that in order for us to address this problem, we need to have our local drug action committees that report into your provincial substance abuse forums, that reports into the Central Drug Authority. So if we don't have all those spheres and if we don't have all of those organs and if we don't have our mini drug master plans basically enforced, how are we going to actually understand how rife this problem actually is in our country? When it comes to SABC is also required to have a mini drug master plan. And yes, last year and the year before, I visited quite a few provinces across South Africa, and the same problem kept on coming up in every community, where communities were saying that, we keep on reporting the same drug dealers, and we find that SABC is obviously on the payroll of these drug dealers, and the same drug dealers are operating year in and year out.
Which is very concerning because, of course, watching and really looking at how young people's lives are disintegrating really calls for drastic measures to be put in place. I know you've interacted with a lot of young people who have either been on drugs or have been affected by them indirectly. Let's talk a little bit about some of the contributing factors, why we find ourselves as a country in a vicious circle which seems to have no end in sight.
The consequences and the challenges are so many on the ground. I look at, again, the community that I hail from, El Dorado Park: unemployment, poverty, lack of opportunities, lack of resources within our communities. You find that kids are dropping out of school at a very early age, forming part of gangs. I always say if a child is not in the classroom, a child is out there learning how to use a firearm or how to smoke a lollipop, or we would find them in the lolly lounges. Also, like I said earlier, child-headed family homes, you find that a lot of these children that are addicted and fallen prey to substance use disorder, they live with their grandparents. Also abuse of the SASA grant. You know, the challenges are just so mammoth, and it cuts across so many departments. When we address substance use disorder, it is not just about calling on SAPs. It is not just about, you know, access into treatment centers. It's about creating a community and environment conducive for recovery, meaning that the lights actually need to be on in the community, meaning that the grass actually needs to be cut, meaning that, you know what, we actually need to connect our youth to opportunities, and we need to ensure that we start with family, you know, making sure that we keep our families together. I always say that if we do not look at the reunification of families, how do we sort of build strong communities, and how do we build a strong South Africa? So when we speak substance abuse, it is not just SAPS, it is not just DSD, it is, you know, it is looking at the borders, it is looking at education, it is looking at tertiary education. There's just so many things that we need to address.
There's also been a call for communities to organize voluntarily rehabilitation programs to provide support to the victims of substance abuse. How effective do you think such programs will be? And also conducting workshops, and if these workshops are to indeed be conducted, the content, what comes out of that, how these young people are remolded. What do you think would be important?
I think when we speak, Mpho, when we speak about community-based centers and also just encouraging communities to start these sort of groupings within their communities, one needs to bear in mind that these centers needs to be registered. When you look at centers like in Limpopo, where you know, people just want to get rid of drug users, where you find that 300 users are locked up in a room, having to sleep there, having to use the bathroom there, that is inhumane. So we need to ensure that when we encourage communities to sort of start support groups and to start community-based centers that deals with substance, that they're actually equipped and empowered to do this within regulation, and to make sure that they actually conform to the minimum norms and standards.
Yeah, that's very important.
Your other question?
Yeah, it was more around the content of such programs and workshops. I mean, if communities are going to say, we've had enough of this drug problem, too many of these young people are falling victim to drugs, in them coming together, what are the solutions? I mean, we've seen how ugly it can get, Dereleen, where communities come together through mob attacks and looking to find ways to get rid of young people who are using substances, and at the same time causing crime and you know, making the area unsafe. What do you think are some of the solutions as communities try and find ways to curb the number of young people falling prey?
I think for one, we need to keep our youngsters, when we look at the ages of the youngsters users falling prey to substance use disorder, it is 8 and 9-year-olds. Now, back in the day, when you abscond from school, your parents would be called, and basically the department would reach out to, obviously the district would reach out to the school trying to find out why that learner hasn't been in school. Today, we no longer see that. You find that today children don't even have birth certificates to actually access education. We need to start there. We also need to keep parents accountable. You'll find that many of these parents themselves are on substance. We find that the Children's Act is actually clear, that says that, you know what, when a when a child is below the age of 18, obviously, and the person is sort of displaying uncontrollable behavior, it is important to reach out to social workers within the area. In many of our communities, we find that these social workers aren't accessible to the families. We also find that we don't have enough clinics. We can have sort of drug testing done that is accessible to our communities and to many families. We find that families have to travel far. We find that there's no access to information when it comes to that. Many communities are actually organized. The community of Eldorado Park, many communities such as Mitchell's Plain, such as Westbury, you find that there are many NGOs that is actually assisting. But what those NGOs actually need, they need support from the various government departments. That is key number one. It is important for every mayor in every municipality to actually establish a local drug action committee. Your local drug action committee is your closest body to the community. And that committee, the formation of that committee needs to ensure that you have a SABC member on there, someone from justice, someone from the community. There are various stakeholders that forms part of your local drug action committee, and that local drug action committee is supposed to sort of organize the committee, the community, to address with the various ills that unfolds in the area.